Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Good morning, Dr. Mencia.
Good
You're
morning.
here, and it's so beautiful outside. It's not raining today.
It's beautiful, yes. It's beautiful. It's a little bit cloudy, but the sun is popping up.
Right, popping up. Well, so are shingles popping up.
Yeah, and shingle popping up left and right. So we're seeing a lot of, interesting cases of shingle, different parts of the body.
I'm seeing it on television a lot. They're trying to sell, what are they selling?
The vaccination.
Well, yeah, is that what they're doing? They want you to take that ahead of time because you can't put anything on it, can you?
Right. Well, the skin with the rash, and you don't get the rash all the time. Rarely you will see the symptom without a full-blown rash. But what is interesting is that area of the skin becomes super sensitive. So let's say if the air conditioner in the car is blowing on your face, it might be pleasant or it might be too cold. If you have shingle on one side of your face, that side of your face, when it receives just the air blowing at your face, it's like somebody blowing your face, it feels like a knife stabbing you. So, minute sensations like that. You take a feather and rub it on the skin, and it feels like a bunch of knife being...
it's amazing.
Right.
And it doesn't mean that there's a lot of open wounds, just...
It doesn't have to do with the wound. It's more with the fact that the nerve from the spine have released the viral that was sitting there dormant. So the shingle, if we think about it, when we were younger and we got chicken pox will show up with a rash all over your body. They usually will isolate us when we have chicken pox and put medication and what have you. And then when it goes away, when the rash disappears, well, if you open any of those blisters, it will remain a scar for the rest of your life. So you cannot,
really?
when you have chicken pox, the kids cannot scratch. Because if they scratch, then that will leave a scar on your body.
They say pox. You have the pox in your face, but it's itchy, right?
It is itchy, and you have to put medication to keep it from itching so we don't scratch ourselves.
So do children still get chicken pox today, or are there vaccinations against chicken pox?
Well, the vaccination is there and it's helping, and we don't see that much. But about 90+% of the population have had chicken pox. So therefore, we are 90+% of the population are prone to shingle. Because what happened when that rash now disappears, now you are immunized, which means if you get exposed to somebody else that have chicken pox or get shingle, nothing will happen to us because we already have chicken pox, so we are immunized. Now the shingle, when the rash go away, the viral goes to the spinal cord in your back. And you know how the spinal cord come down and then spread open and go all around your body and to different organs. It will sit dormant there in where the nerves start coming out. It will sit dormant in your back. And then if you get exposed to any stressor that will affect your immune system, then shingle can come out.
But wait a minute. Okay, so if I've had chicken pox, and most of us can't remember that when we were young, but if I've had it, I don't have to have a shingle shot?
Good question. Yeah, you should have a shingle shot.
I thought you told me that I should have the shot anyway. Yeah, you should have the
shingle shot anyway, because now that you have chicken pox, now we are at risk of developing shingle. So if a person is going to go for chemotherapy, a person develop a really severe infection that affect the immune system, if a person undergoes severe stress, any of those things, and age, that's why the shingle vaccination is indicated for people over the age of 55. And it's a once in a lifetime vaccination. For now, that's all we know because it's very recent. It's under 10 years that it was developed. So it's a once in a lifetime for now. You get vaccinated. And this is going to do one or two things. Make sure to keep the virus dormant where it is. And if it does comes out, that virus, it will be a very mild case of shingle that you will develop. It will be very mild. And it will be shorter lasting for the person that had been immunized and the person that have not been immunized.
Okay, well, that's something I should put on my list besides going to the podiatrist. But I want to ask about, so the shingle, do I have any effects from it, after effects when I have it? I mean, I haven't had anything with my flu
shot. It's like
shot.
any vaccination, yeah. It's
never
like
have
any,
anything,
yeah.
so I don't have to worry about that.
Me also, I have never had any problem. So, it's a shot that, like any vaccination, you might get aches and pain in the muscle and what have you. Some people do get that, and we tell them to take Tylenol. Now, the other question you ask about if a person have chickenpox, should they get the shingle shot? The answer is yes. Some people say, well, I already have shingle. Do I need to get the vaccination? And the answer is also yes. Because there are people out there, and you will hear from people that say, I have shingle twice or 3 times.
Wow.
So it's also rare. It's common you will get shingle once in your lifetime. But the main point, the main reason we should be doing that is also that after we get shingle, there is a percentage of us that will develop the complication of the infection. Remember, chickenpox will come, and the only complication, if you scratch, you're going to have a scar in your body wherever you scratch and pop one of those vesicles that we get. Now, the complication from shingle is called post-herpetic neuralgia, and that's a killer. I mean, those people, the rash is gone, but the nerve sensation's still there, and they are on medication for life, and they go to pain management, so they get the nerve that was affected by the rash, trying to get those nerves frozen, trying to get rid of the sensation, because as you see how they dramatize it on television.
Yes.
It's very true. It's exactly the way they dramatize it. They are not exaggerating. That's how shingle, the patient that suffers from shingle will present.
I think that we haven't made enough of this, you and I. I think this is really important. I'm definitely, by the way, I need some new vitamin D too. I'm out of it. So that's something I have to do. Vitamin D and get my shingle shot. And get podiatrist. And I want to switch over to one more thing with the podiatrist. Since my toenails, I have pedicure and they're polished. Can she still examine my feet without taking off my?
Mm-hmm.
Okay.
Yes. Yeah.
I didn't know if I should come before or after.
Yeah.
Okay.
No,
all right. Well, let's get back to shingles, but I need to come there and do that. So, can anyone have a shingle shot, or do you have to? Are there any people who shouldn't have them?
People with undergoing chemotherapy, they should not get the vaccination. People with a very poor immune system, because the risk now versus the benefit, you are taking a high risk. So, those people should stay away from.
How
the
do they
vaccination.
know they have a low immune system? I mean, if they're not sick.
If you have HIV, there's no been started
something like
treatment,
that, right.
something like that.
Okay.
Or certain chemotherapy for cancer.
So we're going to promote shingle shots.
Yeah, let's buy the stocks.
Yeah, all right. Shingle shots. That's what we're going to do. Do you have enough shots at the office so that you have a run on shots?
Yeah, no. I usually, before we even give the shot, we have Patricia or Ina at the office. check on the patient. It's an expensive shot. It's about $450, I believe, something like that. Check with their insurance first, the carrier, to make sure they are covered. Some insurance will not cover you at the doctor. They will cover you at the pharmacy. So we try to check for that first. I know.
Forget that. I don't go to pharmacy for shots. I go to Dr. Mencia for shots. That's why I never feel anything.
Well, it's also after you get the injection, if you get any complication, the pharmacy cannot follow you up.
Of course not.
Then they throw you to me. And then they say, okay, now go and see Dr. Mencia.
And you don't know if they're going to protect their shots the way you do.
Exactly.
Oh, no. Please, go to Dr. Mencia for... Now, flu. We're not talking about flu shots now yet, but we will soon.
Yes.
But pneumonia shot you can have anytime.
Pneumonia shot you can have anytime, and we should get our pneumonia shot. I just had a young guy that I had to send to the hospital. In his mid-30s, sent to the hospital. He travels a lot, and went to Arizona. Spent some time there. And came back, and we treated him regular, like a little bronchitis and what have you. And just kept coming back. And we have two patients like that, two young guys, the same presentation. And it was getting to the point that I wasn't seeing the improvement that I was expecting. And both of them went to the hospital. One of them was already going into pneumonia. The other one was interesting because it was disturbing me that the X-ray wasn't that, there was not that much impact on the X-ray versus the symptom that he was presenting at my office.
But he couldn't breathe? What's
he was
symptom?
having a lot of shortness of breath and fever, but the white blood cell count was not high. And I said, maybe it's just viral. Maybe it's a viral infection. So I told him, drink a lot of fluid, take Tylenol for the fever. So I said, you're going to go to the hospital. I sent both of this guy. One, of course, was pneumonia. The other one, he travels a lot. He will have an embolism in the lung that could have killed him. So that made me feel really proud. I say, we saved two young lives.
It's because you're watching what should be normal.
What to expect, from taking antibiotic things were looking worse than better. I say, you both, and I told his partner, the guy with the embolism, take him to the hospital. Let's get him there. Let's get him admitted to the hospital. He went to Imperial Point and got admitted right away, got the spiral CT scan of the chest, and the embolism came out. And the patient was put, not before you get an embolism, they have to put you on a heparin, and then they give you this injection or Lovenox to bridge you until the Coumadin start working. Nowadays, they just give you a pill. You take a pill twice a day for 21 days, and then you move on to once a day, and, you are home free. And I saw him this week for follow-up already. He's already home taking his medication, and he's a completely different person.
Yeah, that's the big problem of people trying to medicate themselves. They don't know what to do. And I guess after a few days, like I would call and say, what's going on? You say, well, come in and let me see you. And then, you just see, okay, well, we'll put you on an antibiotic. But are there people who are on antibiotics and then they don't get well? That's like that man didn't. But there are, I guess, there are different kinds of antibiotic. How do you know which one you should give someone?
That's a good question. Is the antibiotic that we choose for an individual, it depends on what type of bacteria we think you might be having. For example, the bacteria that tend to affect the gut and produce diarrhea is very different from the bacteria that can affect the sinuses or the middle ear, your throat versus your bronchial versus your lung. Where do you acquire this infection? Do you acquire this infection in the community, or do you acquire it in a hospital or in a nursing home? The bacteria that surround the skin can be different. So we look at what kind of bacteria we would suspect the person to have. And then we'll choose an antibiotic that will cover, usually broad spectrum mean that you cover a lot of bacteria. And so some antibiotics are broad spectrum, like penicillin is a broad spectrum antibiotic, cover a lot of things. But then you have, then you take the bacteria, you break it into the one that are gram-positive, the gram-negative, the aerobic, the anaerobic. So we have to entertain all of this when making a decision. And then the other thing we have to take in consideration is penetration. So if I'm choosing an antibiotic for the skin, is that antibiotic first is going to treat the bacteria, but can it penetrate the skin and and get to the bacteria that we're trying to get rid of or control? If the antibiotic is meant for the lung, is there a good penetration for the lung, or is it a poor penetration? So there are medication like, let's say, a Keflag is excellent for skin because it penetrates very well, but it's not the best thing for the lung as a primary antibiotic to treat a patient. If we're treating an abscess in the mouth, usually we'll give penicillin BK because it penetrates the tissue of the mouth. And if the person is allergic to penicillin, then we give them clindamycin, which also penetrates the tissue in the oral mucosa in your mouth, and hit most of the bacteria that will produce an abscess.
Well, I remember when I went that I had, a serious, I guess, infection in my chest, and so you did two things. You gave me an injection, and then you gave me a CPAC, or you gave me some sort of, so you did both.
Right.
So you said one, you wanted to get right in there,
right, exactly,
faster,
right,
than a pill would do.
Right. And the injection, usually that's what we do. I usually carry a lot of the injections to avoid hospitalization of the patient. So a lot of time when the patient do come in, like now this long weekend, and we didn't get a lot of infection now toward the end of the week. I don't know if we get some today. But we were able to give the injection to a lot of patients throughout the years and avoid hospitalization, which is the key thing.
You're very big at that, and I know. And the other good thing for you, for people, that there are home visits, because you have someone who's very ill, very old, and they can't get to the hospital, and maybe if they've been at least being seen at home, they are in total communication with you. I know you did that with Bill, that you right, made sure that he was being watched every day. So I've told that to people, and they couldn't believe that you were able to get someone to come every day to check, and it was all provided by Medicare.
All covered by the insurance.
People don't know that.
Exactly. And that's the question that usually will come out of patients. Is it covered by insurance? Do I have to pay for this? No, it's all covered for you. And, most carriers would rather pay for one of my staff to come to your home and see you than for you to end up in the hospital.
Of course.
And if I am on the patient side, I'd rather be treated in the comfort of my home than putting me in a hospital with a bunch of sick people out there and being restricted to the rules and regulation of a hospital, that I had to walk around with the gown and what have you.
No, you're right.
If we can avoid all of that, the hospital has its place. But of course, over the year we have abused, the hospital, and the patient end up paying the consequences.
Well, let me just tell everybody this wonderful conversation that we do every Saturday morning from 7 to 7:30. I think and soon we're going to be hopefully doing something on YouTube that's even going to be more exciting. But at the moment, we're doing this on the radio every Saturday morning from 7 to 7:30, and this is Dr. Andy Mencia. If you looked him up on the web, you would see all the things he's done. He is probably a Renaissance physician, and you don't find too many around. He's is a geriatric physician, so he specializes in geriatrics, and also he has created something at the AGI Medical and Dental Centers in Fort Lauderdale and Boynton Beach that is rare. There are many, many specialists that he has working there. They have a huge dental department. They have so many people there, just as we were talking about the podiatrist. They have people will help you, one-stop shop, I call it. Mm-hmm. And the phone number to call for an appointment, they are open today. Dr. Mencia's got his feet almost on the floor, ready to run out of here. 954-489-1345. 954-489-1345. Remember, there are home visit services available. And if you're in the Palm Beach County area, they have a beautiful office in Boynton Beach. It's on Hagen Ranch Road. Phone number there. Remember, this is Pencil Talk Radio. Get your pencils out. Put it in a notebook so you have it. 561-270-6494. 270-6494. Dr. Mencia,
Yes,
more
love.
than being on this radio show, which you absolutely love, and I love having you come here.
I enjoy this so
You
much.
love your patients more than anything,
I
any
love my
doctor I have
patient.
ever seen in my life.
I love my patients.
You really do.
It's a beautiful profession I have chosen. I studied to be a psychologist. I got my first degree as a psychologist. And one of my professors said, why don't you just keep going through medical school and become a doctor? You're going to do great. You're going to be a good clinician. Become a doctor.
But you're using your psychology that
And
you
you use your
learned
psychology,
in
yes,
your medical
exactly.
practice.
I use that, and I'm able to work with a lot of my patients. And sometimes it's hard to even get a psychiatrist to see the patient, and so I get to see a lot of psychiatric diseases. I remember having we just brought Nando, the student from Nova University.
Oh, right.
But I remember having Dr. Fan went on vacation, and I had one of the Nova students for 2 weeks with me. And he said, Dr. Mencia, I feel like if I'm doing a psychiatric rotation today, because every case, schizophrenia and bipolar and depression and this, it's like from one room to the other one, and we move fast. We want to make sure the patient come, get taken care, and that they go on about their business. I don't believe in having patient wait in the room for 2 or 3 hours. It's not my type of practice. And he couldn't believe how many psychiatric diseases. And I said, most doctors out there, if you go and say, I'm depressed, okay, go and see a psychologist or a psychiatrist. No, I feel that we should initiate treatment. Of course, if I need help, I have my team,
You have
Dana Perkins, the lady with the breast situation that we're going to invite her as a guest over here.
I have to have her name and phone number.
Yeah, we're going to bring her over.
please.
I already spoke with her, and
Okay.
she said she's agreeable to come to the show. And but put our team together, and she always praised me for that. I said, Dr. Mencia, you put such a great thing for every patient that come in with a different situation. It could be a inguinal hernia, or it could be an enlarged prostate, or it could be a breast cancer. I put my team together. And I say, okay, who's going to be the surgeon? And the visiting nurse, the companion system that we work with. We put a whole team together. And sometimes the patient say, but I'm just going for a ventral hernia. Why do I need a visiting nurse? I say, because after the fact. Because,
it's really prevention. That's what I love
something
about
as simple.
what you
Yeah,
do.
exactly. We have to think ahead of the games. We have to be ahead, because you get a little ventral hernia repair or inguinal hernia repair, and something as simple as a cough can burst the suture inside, and then you have to go back again for surgery. And they say, I have the hernia repair, but it's bulging again. It could be something as simple as having a cough, being constipated from the medication they are giving you. And the nurses usually will text me on my phone and say, we saw Mrs. So-and-so, and she's constipated. Ooh, don't let her be constipated. I'll be calling back. What is at home? What can we prescribe? So So it becomes a social
Yeah.
issue that we all usually neglect the social component of healthcare.
You really do. You're extraordinary in this. You do what I have always dreamt of people doing, but they never seem to have enough time. And you have figured out a way to have enough of your team doing that so that you don't have to spend all that time. And I don't know we have enough time. We have 1 minute, but you said something and we can't even cover it now. Maybe we can cover it next time. How do you know when you have a patient who comes in and they're bipolar and they never tell you? You just know it by talking with them?
By talking to the patient and some of the issues. That's a good topic, yeah.
It is, because I think we have a lot of people like this.
We have a lot of people.
And I have a lot of questions about that. Do people get more bipolar as they age or what? But anyway, thank you for coming. Let me give a phone number again.
954-489-1345.
Okay, 954-489-1345. And please go. He's open on Saturday. They're all over there. The dental department is there.
Dental is open.
You got to go and get yourself taken care of. And then their website's agifl.com. And we'll talk to you very soon. I got to go get my shingle shot.
Bye, Anita.
Yeah. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.